it's Jess from Head to Toe Health. We're going to run through a supine bridge now with some progressions to really support the sacroiliac joint integrity and strength. So coming down into a comfortable position on the back, preferably on the floor, you're going to put your feet out so you're in a comfortable position with your knee flexion. From here, you're going to lift up with the hips. So you're going to start by rotating the pelvis. It's almost like tucking the tail between your legs, and you're rolling up from that position so that your knees, hips and shoulders are in line. So pop the hands down by the side. From this position, you're going to rock from side to side onto one foot more so than the other. So it's just changing your weight bearing across one side to the other. And this you do about 6 times each side. If you find you're fatiguing and you're dropping down, you can't maintain that pelvic position, then come down, roll down gradually and take a rest. Okay, so the next progression from that is you can come up, and what we're going to do from here is we're going to run through some pelvic rotations. So we're going to rotate the pelvis backwards. So it's like you're bringing the tail back down and arching through the back. And then you're going to bring the pelvis back up. So it's again like tucking the tail between the legs. So arching the back, bringing the pelvis backwards, and then flattening the back, bringing the pelvis forwards. So again, 6 of those, and then coming down and resetting. If you need to stop earlier, then you're welcome to come down and reset. You're better to get the technique right rather than fatigue. So the next exercise progression from there is again rolling gradually one vertebra at a time up into that starting position, and then you're going to just drop one side of the pelvis down slightly, so you're maintaining the height with the other side and then returning back up. So it's just a 1 to 2 second drop, a pause, and then back up. And again, that drop will vary depending on where you're at. So only go to your level of discomfort, not to pain. Remember, we are trying to work the area, but we're not trying to push it too far. So do 6 of those each side, and then as you come back down, you're rolling down one vertebra at a time until you place the pelvis down. With this exercise, you always want to be focusing on pushing the knees away from you and using the glutes to keep the hips up so that they are in line between your knees, hips and your shoulders.